muscle we are going to exercise is the tricep brachii. It is a three-headed muscle that is principally responsible for extension of the elbow joint and is located at the upper arm. The workout is called tricep dips. First, find something that's around your knee height. Next, you put your hands with the fingers facing forward on the object and stick your leg out to a position where your back is straight. Now you go down and bend your elbow and make sure it forms a 90 degrees. Do the workout 2 sets of 8. There are 3 origins. One is the long head, the infragonoid tubercle of scapula, the lateral head, posterior surface of humerus, superior to radial growth, the medial head, posterior surface of humerus, inferior to radial growth. The insertion is at the proximal end of olecranon process of ulna and fascia of forearm. The action is the bending of the elbow as it goes down and it works out your 3-headed tricep muscles. The synergistic muscles are Anterior, Lattisimus, Dorsi, Teres major and minor, and the Pectoralis major. The antagonist is Brachii.
The next muscle we will work on is the platysma, which is a broad sheet of superficial muscle located in the lower region of the face, neck, and chest. The exercise we will be doing is the chin firm, which stretches and strengthens the platysma. First, we will protract our lower jaw in front of our upper jaw. Then we will elevate our chin so you are staring at the ceiling and hold this position for several seconds. Do this 8 times, take a short break, then repeat it once more. The origin of this muscle is the subcutaneous tissue of infraclavicular and supraclavicular regions, the upper portions of the pectoral, and the deltoid. The insertions are the base of the mandible, the skin of cheeks and lower lip, the orbicularis oris, and the angle of the mouth. Its antagonistic muscles are the masseter muscle and the temporalis muscle.
The next muscle we are going to exercise is the Lattisimus dorsi. This exercise is called the kneeling lat stretch. We will begin by kneeling down on a mat, place both hands on the ground, and try and touch your knees with your chest. This exercise improves the flexibility of the Lattisimus dorsi by stretching it before releasing the tension. We are going to do 2 reps of 8. The Lattisimus dorsi is located on your back and is divided into 2 segments while being partially covered by the trapezius. The action of this muscle is to adduct the arm, medially rotate the arm, and extend the arm. All of this happens at the shoulder joint. The next exercise of the Lattisimus dorsi is called bent over one arm rows. Begin by obtaining a 5-pound or more weight and place your foot on an elevated surface. Try and reach down to the ground with the weight. You should feel the tension on your Lattisimus dorsi due to the hyperextension of your back. Do 1 rep of 8 on both sides. The origin of this muscle is spinous processes of T7-L5 vertebrae, iliac crest of sacrum, thoracolumbar fascia, inferior angle of the scapula, and the lower 3 or 4 ribs. The insertion is floor of the intertubercular groove of the humerus. The synergistic muscles are pectoralis major and minor, subclavius, serratus anterior, trapezius, rhomboid major and minor, and the levator scapula. The antagonistic muscles are deltoid, supraspinatus, infraspinatus, teres major and minor, and the subscapularis.
The next muscle we are going to exercise is the pectoralis major. The exercise is a push-up which is performed in the prone position. The anterior deltoids and pectoralis major work to horizontally adduct the upper arms during the upward phase of a push-up. The synergistic muscles are the pectoralis minor, subclavius, serratus anterior, trapezius, latissimus dorsi, rhomboid major and minor, and levator scapulae. The antagonistic muscles are the deltoid, supraspinatus, infraspinatus, teres major and minor, and subscapularis. Pectoralis major is a large muscle located across the chest from the shoulder to the breastbone. The pectoralis major has 4 actions which are primarily responsible for the movement of the shoulder joint. The origin is the clavicle head and the sternal head, and the insertion is the clavicle head and sternal head as well.
For this next exercise, we'll be working out the Peroneous longus, which is the major muscle of the lower leg, and it is the longest muscle that attaches to the fibula and is used specifically when balancing one's weight onto one foot. Its origin is at the head of the fibula, the upper half to 2/3 of the lateral fibular shaft surface, as well as the anterior and posterior intermuscular septa of the leg. The insertion is the plantar posterolateral aspect of the medial cuneiform and lateral side of the first metatarsal base. The synergistic muscles are the gastrocnemius, flexor digitorum longus, flexor hallucis longus, peroneus brevis, tibialis posterior, soleus, and the plantaris. The antagonistic muscles are the extensor hallucis longus, extensor digitorum longus, tibialis anterior, and the peroneus tetraris. With this muscle, you can perform the actions of inverting your foot and plantar flexing your ankle. It also helps to support the transverse arc of your foot. In this workout, you are performing the plantar flexion movement while the balls of your feet are still planted on the ground. For this workout, we will be working out the tibialis anterior, which is located at the anterior compartment of the leg. It is a muscle that originates in the upper 2/3 of the lateral surface of the tibia and inserts into the medial cuneiform and first metatarsal bones of the foot. The origin is at the lateral condyle of tibia, proximal half to 2/3 or lateral surface of the tibial shaft, the inner osseous membrane, and the deep surface of the fascia curis. The intersection is at the medial and plantar surfaces of the first cuneiform and on the base of the first metatarsal. The synergistic muscles are the extensor hallucis longus, extensor digitorum longus, and the peroneus tetraris. The antagonistic muscles are the gastrocnemius, flexor digitorum longus, flexor hallucis longus, peroneus brevis, tibialis posterior, soleus, and the plantaris. With this muscle, you can perform a dorsiflexion of the ankle as well as invert the foot. For this particular workout, you're performing the plantar flexion movement while inverting your knees and putting all your weight diagonally onto your big toe.